Hi, my name is Monica Williams. I'm an LPN at Indiana State University um, in their baccalaureate program, and I will be doing a health education program today on septic shock. Populations at risk. Some people are going to be more susceptible than others to infection because their system may be immunocompromised or they may have other multiple comorbidities that will make their body less likely to be able to fight off um, infections. But the populations at risk, you have your HIV patients and your cancer patients um, who are, their system is immunosuppressed. Also, the chronic renal disease patients, their systems are immunosuppressed. You also have African Americans who are at a higher risk for being septic because African Americans have other health disparities that they deal with versus other ethnic groups. Also, the obese population, diabetics, males are more susceptible to septic shock than females, and children. Um, and those are mostly the people that are um, at risk for septic shock. The learning objectives for this presentation today is that you will know causative factors of septic shock. You will be able to identify early and late signs of septic shock. You will develop an understanding of the complications of septic shock, and you will have a knowledge of testing and treatments for septic shock. Please pause the video at this time to take the pretest using the link below, and then we will continue with our presentation on septic shock in just a minute. Welcome back, and thank you for taking the pretest. You should find a link below this presentation for a handout. You can use that as a guide while viewing this presentation. Thank you. What is septic shock? Well, septic shock is the body's response to infection that possibly comes from a bacteria in your body. And I won't go in great detail right now because we will talk about that a little bit later in this presentation. But septic shock can be an emergency and life-threatening um, event of illness, and it can also lead to death because if it's not treated or caught in time, um, it can cause other things to happen in the body. So septic shock is what happens when the body responds to the infection and the bacteria. There are some different causes of septic shock, and it usually starts from an infection that could possibly be in the lungs, some type of respiratory infection. It could be a urinary tract infection or some type of skin infection, but the infection is in the body and possibly from a bacteria, whether it's gram negative or gram positive. The infection could be from fungus, it could be from viruses, parasites, and sometimes doctors will have a difficult time pinpointing where exactly where the infection is, but it is infection in the bloodstream. This is what um, causes the septic shock. Signs and symptoms of septic shock will depend on the extent of the infection, and it will depend on the symptoms experienced. Um, Early symptoms, um, unfortunately, can be mistaken or confused with other health symptoms that a patient might have. And that's why testing is very important to help diagnose septic shock. But some of the early signs of septic shock, which is mentioned here, would be fever, warm skin. They may have some increased breathing, some restless and anxiety. Um, Blood sugar may fluctuate up and down. They will have a fast heart rate and increased cardiac output. Late signs could be the cold and clammy skin, respiratory failure, or respiratory distress, altered mental status, um, venous, increased venous oxygen saturation, slow breathing, and decreased cardiac output are some of the signs and symptoms that we would see in a patient who is septic shock. And like, once again, the early signs of septic shock can really be confused with just regular health conditions at sometimes. There are multiple complications of septic shock, and all of this combination of complications can lead to organ failure, tissue damage, and some of those are hypertension. The decreased tissue perfusion can cause tissue damage because there is no blood flow to the proper blood flow to the tissue. The heart rate can slow down. The patient can have a low body temperature that can cause blood clots, slow breathing, fever. They can have altered mental status. Their blood sugar again can fluctuate. And all of these things together can end up causing multi-organ failure and respiratory failure. And some of these patients will go into acute respiratory syndrome and have to be put on ventilators. Testing and treatment. The doctors will use a variety of tests to diagnose septic shock. They will start with blood cultures, which is the general standard for checking for infection in the body. They will also check lactic acid to see if the patient's condition is getting worse. They will also check the arterial blood gases to make sure the patient is not going into respiratory failure. They will take a look at the carbon dioxide and oxygen levels. They will check a complete blood count to look at the white blood cells to see if they are elevated. And they will also check for the C-reactive protein. Some of the treatments that the doctors will use to treat septic shock is to see what that lactate level is and to see what the blood cultures result as. They will also treat originally with broad spectrum antibiotics until the culture sensitivity results are in. And once those culture sensitivity results are received, then they can alter therapy if they need to. They will also treat with intravenous fluids, preferably crystalloids. They will also treat with vasopressors if the patient is hypotensive and the lactate is greater than 4, so that they can keep the mean arterial pressure greater than 65. Doctors will use steroids for inflammation, and some doctors will use a combination of these treatments as a bundle for early management of septic shock. At this time, please pause the video and take the post test using the link below. Thank you.